Okay, there's been a lot of action in Washington this week. Senate Bill 2149 and Senate Bill 5887. Senate Bill 2149 is really important right now, especially since how they postponed a meeting of the Senate on Friday, and now it looks like they may have it on tomorrow on Monday, but they're not quite sure yet. That's kind of a disappointment because we'd like to know when it is so we have a chance to be there. So before we get too much into 2149 though, in what's known as the Rivers Bill or 5887, I'd really like to kind of rant for a second and let's decide what terminology we want to use. In the Medical Cannabis Bill 5073, cannabis is referred to as marijuana, which is a Spanish term for cannabis. In Senate Bill 2149, it's referred to as cannabis, then crossed out into marijuana. And now in House Bill 5857, they want to use marijuana or marijuana. So really? Are we going to change the spelling of a Spanish terminology word? We really need to figure out the terminology we want to use. Cannabis is across the board what I-502 is using and what the medical bill should use and what should be used across the board in all the bills, instead of referring to one bill as cannabis, one bill as marijuana, and possibly marijuana. So let's decide what terminology we'd like to use in the House bills and register it across the board. So enough on 5887 for now, although that's the next important bill after 2149. Okay, so enough rant on terminology. 2149, they may meet in the Senate on it tomorrow, so there's a few really key important points. And things that they're going to try to take away from us. There's a lot of ways that these can be prevented, especially if they're going to create a state registry. But because it's important to get this out there on 2149 and what it takes away from us, we're going to make a quick video so we can get it posted, and we'll reply further on 5887. So right now, 2149 cuts the patient count, plant count, down from 15 to 6, 3 in flower, 3 in veg, and it also eliminates collective gardens, which means that one patient can't help another patient grow, and a provider can't help more than one patient grow. So they want to reduce the plant count. It doesn't outline how patients will get rid of their excess cannabis. It says that they're allowed 3 ounces, but a lot of people can grow more than that off of one harvest, so it says nothing about how they're supposed to legally get rid of their excess, or how much they're allowed to have for a certain period of time. It doesn't do anything to address patients who grow in the spring or summer, or both, in order to supply themselves with enough cannabis for the year, because they don't have the ability to grow indoors as many people do. It cuts our plant count, which could cost us a lot of excess because we can't grow enough to meet our needs. It keeps any of us from having help with our grow, or somebody helping out more than one person who can't grow themselves. And it does nothing to outline how much a patient can have after a harvest other than 3 ounces per week. So those are the most important things that we need to try to get across and notify the Washington Senate about as soon as possible, because they could possibly meet on this sometime on Monday, March 3rd. So let's notify the Senate, call them, email them, and get the information out there that we realize they have certain guidelines that they have to follow according to the feds, and we're willing to help cooperate, but just reducing patient plant count and those type of things isn't the way to do it, and won't help help the market other than to increase the black market. Okay, so our next video will be on 5887, hopefully in a couple of days. Thanks, bye, and stay pain free.